Today I'm going to talk about a condition that is fairly common, affects a large portion of the population, and is more than likely to show up in your classroom through students as well as faculty and administration. The condition I'm going to talk about today, migraine headaches. Migraines are more than severe headaches. They are considered a neurological disease. The symptoms can be debilitating, and in addition to pain, they can include visual disturbances, nausea and vomiting, and even difficulty speaking. Around 12% of Americans suffer from migraine, and it is considered to be one of the most disabling diseases in the world. Attacks can last from hours to days. A migraine has 4 different phases. The first phase is prodrome. This can last from hours to days, and it does not occur every time. Some symptoms can include problems concentrating, irritability and/or depression, difficulty speaking and reading, difficulty sleeping, excess yawning, nausea, fatigue, sensitivity to light and sound, food cravings, increased urination, and muscle stiffness. Next, the aura phase will occur for between 5 and 60 minutes. Now, the aura does not occur for everyone, and it is considered to be a distinct separate phase. Only about 30% of people are going to experience symptoms prior to the headache. Aura symptoms include numbness and tingling, visual disturbances. You might see the world as if through a kaleidoscope. You might have blurry spots, tunnel vision, or see sparkles or lines. You might experience a temporary loss of sight, weakness on one side of the body, or speech changes. Next, the pain of the migraine can last between 4 and 72 hours. During a migraine, there may be neck pain and stiffness. There might be depression or even giddiness or anxiety. Sensitivity to light, smell, and sound, nasal congestion, insomnia, and nausea and vomiting. After, postdome occurs for 1 to 2 days, and about 80% of migraine sufferers experience this hangover phase. They might have a hard time concentrating, they might feel depressed, they might be fatigued, they might have a harder time understanding or comprehending, or sometimes they might even have a euphoric mood. So who gets migraines? Women are 3 times more likely to experience migraines, particularly between the ages of 15 and 55. Genetics can play a role, smoking is a risk factor, and stress can be a factor as well, higher stress increasing the likelihood of an attack. Migraines are diagnosed by a medical doctor, and they can be treated with different types of medications. Massage therapy can also be helpful in reducing pain and improving quality of sleep. Currently, there are many different treatment options. No one size fits all, and many patients struggle to find something that works for them. Let's talk about triggers. One task that a migraine patient must do is pay attention to their triggers. Triggers are any factor that can create a migraine attack. And a key takeaway from this podcast should be that people who get migraines are sensitive to their environment. Migraines can be triggered by their environment. It can be challenging to attend class with a migraine. It can be infuriating to attend school feeling okay and develop a migraine in class due to something in the environment that could easily have been avoided. So how can we work together to make the classroom more accessible to a student who is prone to headaches and migraines? The first few items can be controlled by teachers and administrators. These are lights, sounds, and smells. Lights. Migraines can be triggered by light. Too much light, bright light, flashing and strobing light, fluorescent light, flickering lights. These can all kick off migraines. During a migraine, the person might be a little photophobic and unable to tolerate any light at all. Computer monitors and other screens should be clear and in focus. There should be enough light in the classroom to read and write without eye strain. Some people wear special glasses that help reduce the light that hits the eye. These can be expensive, and not everyone can afford them. Be open to students wearing regular sunglasses. Sounds. Certain types of noise can be irritating, especially sudden loud noises, high-pitched noises, and sounds that whine. When a migraine begins, noises can seem amplified and become overwhelming. Certain noises even hurt. Yes, they literally hurt. Students might deal with noise reduction strategies, such as wearing earplugs or noise-canceling headphones. Smoke, perfume, cologne, and other types of scents and chemicals can easily trigger migraines. Consider the types of smells that they might be exposed to in the classroom, from things like cleaning products, essential oils, and scented hand soap. Avoid using potpourri, air fresheners, incense, or aromatherapy diffusers. You should provide unscented lubricants and lotion for use in the classroom. Be sure to give students advance notice if any of the classrooms are going to be making an exception to this, such as if another cohort has a scheduled aromatherapy class. Even though the student may not be in that class, the presence of those strong smells in the building may be too much, and they might not be able to attend. Emotional stress can cause migraines. The massage classroom should be a place of safety and security. People learn better when they are relaxed and they don't feel like they have to be hyper-vigilant or protect themselves. Your policies and procedures should reinforce that the learning space is a professional environment. It might be possible to identify ways to reduce confusion, frustration, and other negative emotions. So, for example, a student may be very anxious about testing, and they might do better when they know exactly when tests will occur. So reducing popped quizzes in that cohort might lead to an improvement. Missing a meal can cause changes in the body that lead to migraine attacks. Ensure students have enough time to adequately fuel their body and stay hydrated. This is important for all students, but especially for those who have issues with things like blood sugar or who can get migraines if they don't eat. Caffeine consumption can be tricky. Often people with migraines need to be somewhat consistent with their intake, so going too long without a cup of coffee can lead to withdrawal headaches. Providing coffee in the student lounge could be one way to help reduce this, or perhaps you provide a coffee pot and students can bring their own supplies. Being overtired is a struggle that many adults face, and adult students have a large number of priorities that are competing for their time. It can help to explain the biological purposes of sleep. Encourage students to get high-quality sleep on a regular basis, and help them understand that not only will they feel better if they get enough sleep, but they will also retain information and possibly improve their grades. Certain processes happen during sleep that help encode things into long-term memory. Driving to and from class can be difficult, if not impossible, when the student has a migraine headache. Some people with migraines cannot drive at all. Some students might benefit from carpooling with classmates that live close by. They may also be able to ask family or friends to give them a ride or pick them up after class. Ride services are another possibility. Chances are, though, if somebody has a migraine, they aren't going to be coming to class. So students who suffer from migraines may need additional time to fully complete the massage program. The education director or another appropriate staff member can assist the student in keeping track of the classes that need to be made up and finding substitute classes for ones they cannot attend, such as that aromatherapy class. If a student is undergoing treatment for their migraines, they should be sure to let their physician know that they are a student in a massage program. Massage can be safe and effective for headaches. However, there are many times when it may be inappropriate. For example, if the student is undergoing a trial of a new medication, the doctor might ask that no other interventions be used during that time. This helps them see whether or not the treatment was effective on its own. Other treatments include a series of injections. Some treatment protocols use Botox for migraines. Other physicians use different solutions to help reduce muscle adhesions. Be sure to discuss how long the patient needs to avoid receiving massage locally to the areas injected, And also ask if they should avoid general massage entirely for a time. In other words, check with the doctor about the contraindications as far as massage. If the student has any restrictions, it is important to document them and then let course instructors know. So if the doctor has said no stretching, it's not in the student's best interest to receive stretching. Now, an instructor could push the student not knowing about that medical restriction. They could say, hey, why don't you give it a try, see how it feels? And the student may not feel comfortable standing up to the instructor. Other times, the student might assume that the instructor has been fully informed and has decided, as the expert, that stretching is okay. This ends today's podcast episode of I Have a Student Who. Thanks for joining me. And special thanks to Ruth Warner for her expertise on today's topic. Tune in for my next episode of I Have a Student Who Isn't Motivated.